Today I'm going to tell you how to differentiate between heart failure and chest infection. A lot of people who are above the age of 60 may come with an overlap of symptoms which may either fall into the category of heart failure or COPD. I have a gentleman who's in his 70s who has low ejection fraction on his echocardiogram, but is also a long time smoker and has a history of COPD. Recently, he's been troubled with shortness of breath at rest. On lying down, especially when he takes a turn towards the left, his symptoms improve on getting up, but simultaneously he finds it difficult to walk. So he's got exertional breathlessness, and this is gradually progressive. What I can show you here is that I've got all of these medicines which this gentleman was prescribed. I've got diuretics here of two kinds, and then I've got Montelukast, and I've got blood pressure tablets. I've got an SGLT2 inhibitor as well in a pretty heavy dose. Then I've got anti-diabetics of different kinds and antihypertensives. So I've got a multitude of these drugs, and which means that his treating physician was probably not sure which way to go, whether he was being treated for underlying pulmonary disease, or he was being treated for heart failure, or he was being treated for ischemic heart disease. But nevertheless, his symptoms have worsened gradually, and instead of showing improvement, he's actually going down. So I'm going to show you on examination and a few important points on history which can differentiate between heart failure and between chest infection. On history, the most important thing is orthopnea and PND. Patients who've got COPD with acute exacerbation can have orthopnea with or without PND, but these patients may not cough at night. If there is orthopnea with coughing, this will go towards heart failure more than chest infection. Nevertheless, if somebody's got acute exacerbation of COPD, they can have a productive cough and they may find it difficult to lie down, but they will not be orthoptic. So, orthopnea along with cough is going towards heart failure, and orthopnea without significant cough may go towards COPD. This gentleman has orthopnea but does not have cough. And from the time that we started making this video, if you can see that he hasn't coughed even once, so that means that his respiratory system is clear. He's not showing any signs of panting. He's not breathless, and he's very comfortable at rest. So therefore, it means that he does not have acute exacerbation of COPD, and this may go towards either way. It can go towards heart failure as well. And now examining him, his hands are pretty warm and his palms are red. He doesn't have any telltale signs of heart failure. The skin is nice and it's got a normal texture, and his pulse is not bounding, and he does not have a tachycardia. So the absence of tachycardia, absence of a bounding pulse, both of them means that he is not retaining carbon dioxide. Likewise, he does not have low ejection fraction. He does not have any pallor. In fact, his hemoglobin seems to be all right. Zuban dikhaya jaye. And he does not have any central cyanosis. Mehrbani. Now comes the important part, and that's the JVP. Sitting, often it is difficult to assess the JVP, but nevertheless, in people who've got stage 3 heart failure, they can have JVP even at rest while they're sitting down. And we can see he does not have a high JVP. And then we'll do a hepatojugular reflex, and he does not have a high JVP either. दोवें हाथ बाहर कढ़े आ जाए, and दोवें हाथ बाहर कढ़ो, जरा थोड़ा जो ऊपर रखो, and there is no ऊपर रखो जरा, and there is no flap, and he does not have any peripheral cyanosis either. मेहरबानी चलिए कर लो, थोड़ा जो ऊपर कर लिए बस. The legs are thin. He does not have any peripheral edema. He's got normal hair, which means he does not have any trophic signs. And it's the same thing on the other side as well. Similar findings means that the absence of edema means he does not have heart failure. We have to remember people who have heart failure, may it be heart failure class 1 or class 2, they may have evidence of edema, especially if they're elderly or if they've been taking medication. So they may show some evidence of edema, especially around the ankles. It may wax and wane, but nevertheless it will be there. This gentleman does not. He's got very nice thin lines, so that means he does not have any evidence of heart failure. On percussion, I can hear resonance, and that is equal on both sides. मुंह खोल के लंबे लंबे साल वगैरह. And he's got normal breath sounds and normal vesicular breathing. There is no prolonged expiration, so thereby he does not have underlying emphysema. Now he's coughing. लंबा साल हुआ. शाबाश. एक बारी फिर. See, when I've asked him to cough, when I've asked him to breathe in, he will cough, and this goes towards chest infection. So he's got COPD. He does not have any evidence of heart failure. He does not have any peripheral edema. JVP is not elevated. But when I ask him to take a deep breath in, and now I'm going to show you. Now I'm going to show you the same critical sign or symptom, whichever you may call, that asks the patient to take deep breaths in. When the patient coughs, the patient has got chest infection and not heart failure. फिर लम्बा सा लो, एक बार फिर लो, बस मेहरबानी. So you ask the patient to take deep breaths in, and the patient is going to cough after a short pause. So you can auscultate him again. लम्बा सा, ठीक, दोबारा, बस ठीक हो गया. आ जाओ. Auscultate the heart. I'm looking for a third heart sound. There is none, so it's not tachycardic, and the heart is not a blood pressure. And then looking for the abdominal organs. नहीं ठीक है. He does not have any ascites, and the liver is not enlarged. So there we have it. There are no features suggestive of heart failure, which means that these heart failure medications which he's been taking, they're unnecessary, all of these tablets. So in essence, the diagnosis is COPD with frequent acute exacerbations, and he's a diabetic as well and a hypertensive as well. Now we have to remember, heart failure is of two types. One of them is a left heart failure and the other one is a right heart failure. Left heart failure is a condition of symptoms, and right heart failure is a condition of signs. And when they both mix together, we call this congestive heart failure, and that means there is congestion in the lungs, there is congestion in the peripheries, congestion in the liver, congestion in the abdomen, and that is right heart failure caused by left heart failure. Yes, thank you.